Would you believe it? This is actually the half point of our discussion. I'm very surprised that I've even gotten to that right now, but maybe a few more years and we'll actually finish the series. Ha ha. So next on our list is Haemofilus influenza type B vaccine, also known as Hib vaccine. Notice how previously we would talk about vaccines against specific diseases. This one is a little different because it's a vaccine that can protect you from a variety of diseases caused by Haemofilus influenza type B. HIB is a gram-negative bacteria that's responsible for many of children's diseases. The most common ones are pneumonia, epiglottitis, bacteremia, and meningitis. It can also cause ear, nose, throat, and eye infections. It doesn't affect just children though, as HI is a prominent cause of bronchitis and pneumonia in adults as well. On a side note, don't be confused by the name. Haemophilus has nothing to do with the flu. Bacteria were discovered before viruses, and Haemophilus was widely believed to be the cause of influenza. When we eventually discovered the flu virus, the name stayed out of convenience. The bacteria itself is not very prominent. What you need to know is that there are 6 distinct strains of it, titled A through F. The most common cause of infectious diseases is type B strain, hence the vaccine is called Haemofilus influenza type B vaccine. Make a mental note, the vaccine doesn't protect against every type of Haemophilus, just the most important one. The mode of transmission is airborne and the source of infection is generally other sick people. Haemophilus can be routinely encountered as part of normal microbiota of our nose, throat, ears, and sometimes even skin. It won't be causing any symptoms but can still be transmitted. Alternatively, it can cause an infection in the host when said host's immune system weakens. In this chapter, I will describe the primary reasons for concern with Haemophilus infection. What you should be worried about is pneumonia, epiglottitis, bacteremia, and meningitis. I also won't be describing the last 2 forms here, they're not particularly different from meningococcal infection and I don't want to overburden one video with too much information, so symptoms of bacteremia and meningitis will be covered extensively at a later point. I probably mentioned it before a time or two, but the main cause of death in young children is respiratory problems. Children's airways are incredibly reactive and prone to infection, swelling, and obstruction. Their lungs don't have the same defensive capacity, they tolerate lack of oxygen worse given limited resources for compensation, and their additional respiratory muscles are underdeveloped, meaning that an increase in work of breathing may not be able to produce adequate ventilation. This underlines the importance of vaccination, as Hib is one of the most common causes of pneumonia and can also cause epiglottitis. Both diseases have a distinct characteristic: it can become very hard to breathe. Now that we've established the importance of those infections, let's actually take a look at them. Pneumonia is an inflammatory process in the lungs. Clinical symptoms of pneumonia can vary depending on the severity of the disease, and the main cause of concern is the degree of respiratory failure associated with it. In mild cases, patients can present with malaise, small fever, dry cough, or cough with minimal sputum. There will be minimal signs of respiratory problems. Patients may complain that they have some difficulty breathing, especially when lying straight on their back. As far as observable evidence goes, we can see some mild increase in respiratory rate. Young children won't complain of general symptoms, and in their case we note behavioral changes, such as bad mood, loss of appetite, and decrease in their activity or crying. In more serious cases, people will experience notable difficulty breathing. Their complaints will address that and may also note that they can only comfortably breathe when they're sitting. Their respiratory rate will be increased and they will also use additional breathing muscles. If the increases in respiratory rate and depth can't compensate for lack of oxygen, people will disable cyanosis. Parts of their body will start turning bluish or purplish due to having deoxygenated blood. In respiratory failure, cyanosis is most notable on lips, ears, on the tip of the nose, as well as fingernails. When it comes to severe cases, the picture starts looking very grim. Breathing problems are taken to the extreme here. If there's still consciousness, these patients are at first extremely agitated. They will often be looking for a more comfortable position so that they can breathe, even though their most comfortable position is while being seated. They roam around the bed and exert themselves even more, which worsens already existing breathing problems. While in this agitated state, they'll often bother everyone around them to help them somehow. While they're at it, they will have trouble speaking. They can talk in short phrases, singular words, or speak gibberish. As their lack of oxygen grows, their consciousness will slowly shut down and they will go into hypoxic coma. Patients experiencing acute respiratory failure very often require some form of mechanical respiratory aid, be it non-invasive ventilation or mechanical ventilation. Severe cases of pneumonia are also notable for causing multiple organ failure, something clinicians refer to as sepsis. Alongside severe pneumonia, you'll commonly see very low blood pressure requiring special medication and renal failure that can require renal replacement therapy. The most extreme cases, known as acute respiratory distress syndrome, can go as far as needing artificial circulatory support, which will directly oxygenate the blood with the help of an oxygenator. The other common form of Hib infection is epiglottitis. It's an inflammatory process of the epiglottis, a cartilage that closes the trachea upon swallowing, making sure that the food we eat doesn't get into our bronchi and lungs. Common symptoms include fever, throat pain, difficulty swallowing, drooling, and voice changes. These symptoms are of minimal concern, however. The real reason we fear epiglottitis is due to potential of airway obstruction. Think of it this way. It's a cartilage that's normally supposed to obstruct our trachea when we're eating. If, however, it were to become swollen, it could start obstructing the airway all the time. And we especially fear it in children because they have highly reactive airways. They are very prone to edema and constriction. Besides that, children don't tolerate respiratory problems well. A lot of children presenting with epiglottitis will need tracheal intubation to make sure that they can breathe adequately. The first vaccine against Hib was a polysaccharide vaccine. Haemofilus has a special polysaccharide capsule. Capsules, as we've previously discussed, are designed to protect the bacteria against many external influences. Luckily, our immune system reacts very well to it and produces protective antibodies. The first type of vaccine contained only this polysaccharide capsule, but unfortunately didn't show great results. The immune response to it resulted in activation of B cell production, but not T cell production, and even worse was that it didn't result in creation of memory cells. The solution to this problem resulted in the modern version of the same vaccine, called conjugate vaccine. Essentially, the same polysaccharide is attached to another highly immunogenic protein. As a result, this combination elicits a much better T cell response and creates T cells, B cells, as well as memory cells. There isn't much to talk about when it comes to this vaccine. It's fairly new on the market. Many countries don't have it as part of their vaccination schedules yet. We don't have long-term research on how good the immunity is and whatnot, and it's not very important for us at the moment. What we do have is clinical data for lowering rates of Hib infection in general and especially Hib epiglottitis. Adverse effects are pretty much limited to injection site reactions. Finally, let's draw a comparison. What we have on one side is minimal risks of adverse events, most of which are pretty mild in nature. On the other, we have the ability to prevent rather common infections that can be lethal for children and also for adults, which we kind of didn't discuss in depth here.